Hey guys, Davin Lim, board certified dermatologist. You'd like to know more about niacinamide and how to use the skincare ingredient to treat pigment. So niacinamide, what is it? It's a vitamin. It's classed as vitamin B3. So when you talk about skincare vitamins, there's basically three. Your A, B's and C's, which are most popular. A is basically vitamin A, your retinol or your retinoids. B or B3 is niacinamide, and C of course is ascorbic acid. So today's video will be concentrating on vitamin B or B3 niacinamide. What can it do for your skin in the context of pigment? Basically, it has three functions. First of all, it can reduce inflammation, and it's most useful for treating things like acne, but also rosacea. So with acne, if you use that, it can decrease the amount of inflammation, but also prevent or reduce what's known as post-inflammatory hyperpigmentation. In other words, dark marks from acne, right? So that's number one, anti-inflammatory role. Number two, it also has a very good skin barrier function role. So basically, if you have conditions like acne, your barrier function of your skin is not intact. And when it's not intact, it can cause inflammation, but also pigmentation. So niacinamide is very good at repairing your skin barrier function. It's also very gentle. So when you look at this skincare ingredient, comparing it to something like your retinol, your retinoids, your ascorbic acid, and your skincare acids, niacinamide is the go-to if you have sensitive skin. And if you have conditions like acne or acne rosacea, certainly skin sensitivities are heightened. And hence this is why it's one of our favorite ingredients when it comes to treating acne or acne-prone skin together with pigmentation. Last of all, niacinamide has very weak inhibition roles when it comes to suppressing pigment. So what it does is that it can reduce what's known as your tyrosinase activity. Tyrosinase is the enzyme which is in your pigment cells which produce melanin or pigment. In the scheme of things, it's very weak compared to things like your hydroquinones, your azelaic acid, and your ascorbic acid. However, in the context of niacinamide, is that balance between inhibition and improving pigment and sensitizing your skin or making your skin too sensitive to ingredients. So this is how we balance things. How do we rate it at the Melisma Clinic? Well, it's something which I personally don't prescribe much because when patients come to see us, we usually treat them with lasers, chemical peels, or prescriptive skincare. However, acknowledging that if you have mild pigment or would like to try something at home, then certainly niacinamide is a go-to, especially if you have sensitive skin.